temperament, in other words, the uniqueness of individuals. I'm your host, Farooq Hussain, and joining us in the studio today is our guest, Dr. Mujib Hussain. In this program, I would like for our guests, Dr. Mujib Hussain and Professor Bika, to assist us in understanding the whole question of the uniqueness of an individual's temperament. We all know that each one of us is unique in the way in which we talk, in the way in which we think, in the way in which we act. So to get greater clarification on this issue, I want to direct the question to Professor Bika and to ask Professor Bika if he can share with us what is meant by the uniqueness of an individual or an individual's temperament as it is known in Tibb medicine.
Jazakallah khair. Assalamu alaikum, viewers. The concept of temperament or the uniqueness of an individual is not a new concept. This is a concept that was actually prevalent again in all the old traditional systems of medicine. For example, if you look at the Chinese system, they talk about the yin and the yang relationship. Then in Ayurveda, they talk about the Vata, Pitta, Kapha types. Okay, of course in Tibb, which as we know, mentioned previously, the source is from the Greek philosophies, and Hippocrates, and more so Galen. And Galen was the person who came up with the concept of temperament. And according to Tibb, they've defined people into 4 different temperamental types. A little later, my colleague Mujib will elaborate more on that. But what is temperament? Temperament is the combination of a person's physical, mental, emotional, and spiritual attributes. It combines all of those components put together is what can be called a person's temperament.
Wonderful insight. In other words, that how we are shaped physically, to a very large extent, will suggest then to the critical Tibb practitioner what kind of temperament perhaps a person might have. If that is true, Professor, then perhaps it would be useful to ask our guest, Dr. Mujib Hussain, to expand a little bit more on that and to share with us his insights into the different types of temperaments.
Okay. To answer your question, I have to begin with the basics.
Right.
Where is temperament derived from? It's actually derived from the understanding of elements which makes up creation.
Right.
So the element of fire, water,
right.
air and earth. From these elements we derive the qualities of heat, coldness, moisture and dryness. So what's the significance of this? Everything in creation is made up of these 4 qualities: heat, cold, moisture and dryness. But what separates the different entities from each other or individuals from each other would be the proportion of these qualities. For instance, if you were to pick up a gem or a rock, the dominant quality of that would be cold and dryness. There's a level of heat and moisture in it, but it's too little to actually overpower it. So the dominance is cold and dryness, so that defines its quality as being a hard, cold entity. Likewise, individuals, as we are sitting here, we are made up of different qualities. But certain individuals will have a higher degree of heat in their bodies, so they'll find the summer months unbearable. Certain individuals have a high level of cold in their bodies. They will find the winter months unbearable. So these qualities are in different proportions in different people, and this is what separates us from each other. This is basically the concept of temperament. So we have 4 basic temperamental types. We have the sanguine or the sanguineous temperament. This individual has a high level of heat and moisture in the body. So if you look at them, you'll see they have a reddish tinge on the skin. The phlegmatic individual, they have a high level of cold and moisture in the body. And due to this cold and moisture, they are prone to phlegm-related conditions, hence the word phlegmatic. So I'm just trying to allude to where we're going to concentrate on further when we go into the actual different body types and the personality traits. And at the end of the day, each temperament is comprised, as Prof mentioned, of personality traits, emotional traits, even your disease predisposition. The third temperamental type would be the melancholic person. They're dominated by cold and dryness. This level of cold and dryness defines who they are in terms of their bone structure will be thin, bony framed. They'll be prone to cold conditions like winter ailments. The fourth temperamental type would be the bilious. They're dominated by heat. They have a high level of heat and dryness in the body. This level of heat and dryness defines their character. They're leaders. They're very to the point. They tend to anger quick. So I'm just touching on some of the emotional traits just to highlight how the Tibb practitioner actually views the patient. When we see the patient, we begin by looking at the temperament.
Let me not be an agent provocateur, but to ask of you, and you don't have to be accurate, and to give you a clue, in winter I find that my fingers get icy cold, and you find it in the fingertips even going blue. What does that suggest to you? What kind of type am I?
That would suggest that you have a high level of coldness in your body innately. And we'll speak later on how this knowledge can be used to actually better your health and to practice preventative as well as curative medicine.
So that's wonderful. Just to animate this theory and the ideas that have been elaborated by Dr. Mujib Hussain and Professor Bika, I have for you a short clip that describes and looks at the personality traits of these 4 different temperaments in real life.
Hey, you guys are quiet, must there? Lekker day outside, huh? How nice is it outside, huh? I can smell that perfume, man. It's very nice perfume that you got on there, man. Ah! Yeah, somebody got me lekker out. They put the thing on the tech on my chair, yeah. You clever, you. That almost worked, but thank you for making me feel so lekker and welcome here today, man. Who the hell had the audacity to put this tech on my chair? Huh? Do you know who I am? Huh? I will get you, I know where you stay, and I will... Life is like a tech, man. Yeah, it's hard and short and very painful.
A real insight into how the different temperaments cope with a real life situation. I suppose it would be useful to ask Dr. Mujib Hussain on how then do you identify a person's temperament, as you alluded to earlier on when you shared with me what kind of temperament I might have.
Okay. There are various factors that we use as the practitioners to analyze a person's temperament. The most reliable one would be the physical appearance. So we find the sanguine individual, they're dominated by a lot of heat and moisture. These individuals, they'll have a more medium to large frame, more muscle than fat. We find that they have a macho stride. If you look at their complexion due to heat and moisture, they could have a red tinge on the skin. The tendency is due to the heat. They'll have a higher metabolism, so they have a very good appetite. They prefer cooler weather, cooler beverages, cold foods. Their speech would be very clear, moderate speech. The traits, they are the playful individuals. They're very cheerful, the life of the party, the socialites basically. They're very humorous. They like to crack jokes. Their behavioral patterns, they tend to exaggerate sometimes. And what's the importance of the information? The importance is that by knowing a person's temperament, we can know what behavioral patterns is suited for the individual. And when the person is acting without that, we know that without their temperament, and therefore they will increase their predisposition to disease. So the sanguine individuals, due to their heat and moisture, they predispose to hypertension, to diabetes. So if I were to go to a public hospital, for instance, and I would take out individuals that fit this profile, personality traits, the body frame, and I would ask them, how many of you suffer from high blood pressure and diabetes? 9 out of 10 will find out that they suffer from these ailments. So we can use the temperaments. By knowing someone's temperament, we can practice preventative medicine. Now we have the phlegmatic individual. They're dominated by cold and moisture. So hence the word phlegm actually comes from the word phlegmatic. So due to cold and moisture, we find these individuals, they have more fat than muscle. So therefore we find that we cannot prescribe diets across the board. You know, these individuals, they will pick up weight easier due to their cold and moisture, water retention. So these individuals will find that they will have a pale to whitish complexion. They have a very slow stride. They speak slowly. Some people would become very impatient with them. On the flip side, they're compassionate people. They're in touch with their emotions. When you meet a phlegmatic person, for some reason, you feel that you want to connect with them emotionally. You'll speak to a phlegmatic stranger about your life. You don't know why, but somehow your innate temperament recognizes this person's temperament. So each temperament has weaknesses and strengths. So the benefit of understanding temperament is that we can bring out the strengths of the individual and allow them to accept their weaknesses. So we find the phlegmatic individuals, they have quite a imbalanced digestion or weakened digestion due to the coldness in their system. Like we said, they're prone to colds and flus, so we'll find they're asthmatics. They'll have the sniffles throughout the year or throughout winter. We said they gain weight easily. They're very calm individuals. They introverted individuals. They're very shy. They wouldn't be the people to give a speech very easily. It doesn't come naturally to a phlegmatic individual. So by understanding this, we wouldn't put pressure or undue pressure on certain people. They tend to be a bit indecisive on certain things. We come next to the melancholic individuals. They are driven by cold and dryness. The body structure would be thin, bony frame. So these individuals, they're quite anxious individuals. They walk fast, they talk fast, they're all over the show sometimes when they're out of balance. They tend to have a cold and dry skin. Due to the cold and dryness in their body, their skin would always be cold. So during winter, they'll be layered with clothing due to this coldness that's innate within themselves. They have a very irregular or variable appetite. They're very erratic eaters. They suffer from insomnia. They suffer from cold conditions. For instance, constipation, indigestion. Their personality traits or their emotional traits, they're philosophical people. They're deep thinkers. They're the scientists of society. They're the individuals that they'll be concerned about questions that others wouldn't be concerned about because they think so deeply. They can be a bit suspicious. They can be a bit worrisome. They tend to be very logical and they're perfectionists. They're also the natural-born artists of society. They're creative people. So if you recognize my kid or my teenager as a melancholic, steer them in the direction of art or creativity, drama. So the temperaments can be used for all facets of life, especially for healthcare. We come to the bilious individual. They're driven by heat. So the element is fire for these individuals. So like fire, they're very outspoken. They're dominant. They can become aggressive. They're the natural-born leaders of society. If a bilious person is heading your company, they'll take the company forward, but they could become too impatient with those to follow. They're prone to inflammatory conditions due to the excess heat in their body. They're also prone to chronic fatigue syndrome because they tend to be the workaholics of society. They push themselves to the limit. Their sleeping patterns, they just need about 5 to 6 hours to sleep because they're so driven by heat. So for these individuals, they should watch their heat during the summer months. If they watch their heat during the summer months, taking enough water, they can actually control their anger by avoiding spicy foods. And I'm just touching on how a TEMP practitioner would treat a person, looking at their temperament. If I were to take a bilious person's hand, they would give a firm handshake. I would feel the heat emanating from their hands. The veins would be superficial due to the pounding of their pulse. So as TEMP practitioners, when we call our patients or we meet our patients, on our first sight, we analyze already. We can gauge that this person's a bilious individual. We know they're driven by heat. They're natural-born leaders. So if we find out that they're in a position of below authority, we know that one of the causes that they came to us would be work stress. Even though they came to us with a physical condition, they're not in the ideal setting. So by understanding your temperament, we can tell you what career choices are the best way to go, what best health choices to make, how to actually manage your condition. So ultimately, the temperaments are there to empower the patient, and it's an essential tool for the practitioner to actually diagnose and treat.
Dr. Mujib Hussain, I beg your pardon, as a practitioner, sir, why is it important then to know the temperament of your patient?
Okay, to answer your question, I would rely on the words of Hippocrates, who has said that it's more important to know what sort of person has the disease than to know what type of disease a person has. In other words, we are worried about the condition, but who are you? By knowing who you are, it tells us about what your susceptibilities are, what are your ideal temperament or ideal environment, what foods, what regimen, what herbal treatments, what therapies can be tailor-made to suit your condition. In other words, by doing that, we can actually ensure a better, healthy living.